Hi, I'm Selena Campbell, frequent host of the Fertility podcast. This is Infertility. As you're probably aware, October is Breast Cancer Awareness Month. So this month, we'll be releasing videos about a topic that's very close to our hearts here at Progeny, and that's oncofertility. Before we dive in, we just want to say thank you to all of our subscribers and to encourage you, if you haven't already, subscribe to the channel, please do so. Oncofertility is a field of medicine concerned with minimizing the negative effects of cancer treatments like chemotherapy or radiation when it comes to survivorship and future family building efforts. We're talking about treatments like fertility preservation, which could be egg or sperm freezing for those who are about to undergo cancer treatment. Oncofertility isn't exactly a new field of medicine, but in the past couple of decades, it's become an extremely important piece to the cancer treatment puzzle. Today, we're going to talk about why oncofertility has emerged as such an important part of treatment in recent years, and how oncofertility can play a role in positively impacting cancer treatment itself. But if you want to get a deep dive into oncofertility and treatment options, then you should subscribe to This is Infertility. That's our podcast, and it's available wherever you get your podcasts. And we just published our Oncofertility 101 episode. But you also don't want to miss today's conversation with Dr. David Riley, a reproductive endocrinologist at Boston IVF and a clinical instructor at Harvard Medical School. We discussed oncofertility and specifically why this field of medicine has become so important and effective in recent years.
Our oncology colleagues have done a wonderful job. Why? The use of chemotherapy agents, surveillance, radiation therapy. We've impacted the lives of men and women suffering from cancer in ways that back into the 1970s when I was a kid, we would never have dreamed of. Malignancies impacting women, for instance, of reproductive age, those women who still have the potential to have children, such as cervical cancer, ovarian cancer, breast cancer, the most common amongst this age group, lymphoma, leukemia. Those particular illnesses had survival rates in the 1970s of less than 50%. But due to the incredibly sophisticated use of medications and treatments by our oncology colleagues, these women are surviving with success rates well over 80%. And the number one question these women and men want to know is, how will this impact my fertility? And I'm a survivor, and I want to build a family, and they now can do so.
Cancer treatment has become so effective that those undergoing treatment should now expect to plan for life after cancer. But it's not only cancer treatment that has improved in the past few decades. Fertility treatment and fertility preservation methods in particular have improved dramatically at the same time.
So in parallel with these oncology therapies and this increased survival has been IVF. And you can utilize IVF to preserve fertility for women and men who are now surviving.
A cancer diagnosis is typically devastating. But with survivorship rates as high as they are now, and with the family options that are available to these patients, there is real reason for optimism. And that optimism can be extremely powerful.
Men and women are suffering, and they see their oncologist inappropriately. They're worried about prognosis. They're worried about side effects. All the things that scare them about not only having this diagnosis, but how it's going to impact their future. The patients come to see me, and we're talking about when this is behind them, when this is over, we're going to help you build a family. And it allows me to make them have a positive attitude or help them have a positive attitude. Studies have confirmed that couples who can focus on the treatments that are going to allow them to become parents are going to do better. They're going to face their oncology therapies with a better attitude. They're going to be more motivated to go through it, to reach that goalpost, because when they do, they are going to have a fulfilling life, and it allows their oncologists to give them the appropriate treatments and for the patient during that time to maintain a positive attitude, which will help them not only survive their treatments, but face the future in a positive light.
Oncofertility is a real option for those about to undergo cancer treatment. If you or someone you know has a diagnosis and is still of childbearing age, it's important to ask about oncofertility option. And if you or someone you know has already undergone successful cancer treatment, there still is cause to go see a reproductive endocrinologist, as there is a lot that can be done for patients even after treatment. We're going to dive more into that in the next week's video. Thank you for watching this video. Again, please click the like button and subscribe, as that will help others find it. Also, if you want a ton more information about fertility treatment or anything else fertility related, we have a wealth of knowledge for you at progeny.com/education. And if podcasts are your thing, check out This is Infertility, wherever you get your podcasts. Thank you.